The medical assistant is often responsible for collecting microbiologic specimens in the medical office. A specimen is a small sample taken from the body to show the nature of the whole. To prevent inaccurate test results, good techniques of medical and surgical asepsis must be practiced when the specimen is obtained. The medical assistant must be careful not to contaminate the specimen with extraneous microorganisms such as the normal flora. Extraneous microorganisms grow and multiply and may obscure and prevent identification of pathogens that might be present. The medical assistant will show you how to collect a specimen using a collection and transport system. The specimen will be sent to an outside laboratory for culture. A collection and transport system consists of a sterile swab and a collection tube with a transport medium. The transport medium prevents drying of the specimen and preserves it in its original state until it reaches its destination. Before proceeding, sanitize your hands. Greet the patient and introduce yourself. Identify the patient by full name and date of birth and explain the procedure. Assemble your equipment. This includes a tongue depressor and a collection and transport system. Check the expiration date on the collection tube. Position the patient and adjust the light to provide a clear visualization of the throat. You need to be able to see where to obtain the specimen. Apply your gloves. Peel back the envelope part way and remove the cap from the collection tube. Remove the cap swab unit from its peel-apart package, being careful not to contaminate it. This could lead to inaccurate results. Place the collection tube in a convenient location. Depress the tongue with the tongue depressor. This makes it easier to access the throat. Place the swab at the back of the throat. Firmly rub the swab over any lesions or white or inflamed areas, a likely place for pathogens. Use a rotating motion to deposit the maximal amount of material on the swab. Swab the mucous membrane of the tonsillar area and the posterior pharyngeal wall. Avoid touching the other areas to prevent contamination of the specimen with extraneous microorganisms. Keep the patient's tongue depressed as you withdraw the swab. Remove the tongue depressor from the patient's mouth and discard it in a regular waste container to prevent the spread of microorganisms. Insert the swab into the collection tube. Do not allow the swab to touch the outside of the tube. Push the cap swab unit in as far as it will go to immerse the swab completely in the transport medium. Make sure the cap is tightly in place. Remove your gloves and sanitize your hands. Label the collection tube with the patient's name, the date, the source of the specimen, which is the throat, and your initials. Place the collection tube in a biohazard specimen bag and seal the bag. Complete a laboratory request form. Place the laboratory request in the outside pocket of the specimen bag. Chart the procedure. Include the date and time, the type of collection, and the date the specimen was transported to the laboratory. File a copy of the laboratory request in the patient's chart. Place the specimen bag in the appropriate location for pickup by laboratory courier. The specimen must be transported to the laboratory within 24 hours.